Thank you, Selena. So for our next session, we have Janelle Mirabeau. She's a quality improvement team leader at Sibley Memorial Hospital, a member of the Johns Hopkins Medicine, where she works across departments and clinical specialties to identify opportunities to improve patient safety and quality care. Welcome, Janelle.
Thank you so much for having me. Thank you to Selena, Lori, Madeline, Yesenia, all of you for sharing your personal experience throughout this time. I am thrilled to be here with you all today to discuss such an important and timely topic. And as I learned more about Women's Heart and the amazing work that you do in your communities, I am so much even more honored to be part of this discussion today. So I wanted to first share, we'll do about 20 minutes of discussion where I'll be sharing some history of the past, talk about the present, and also moving into the future. I'll give a moment for those to look. Thank you so much. So here's our roadmap for today's discussion. We begin in the past because every superwoman has an origin story, and I want to highlight some of the pivotal moments that we celebrate that have led us to today, and also welcoming a brighter future with open arms. So let's get started. This quote that I've included here of "We must work together to take an integrated approach to health, hunger, climate, and the equity crisis. No one is safe from COVID-19 until everyone is safe," really resonated with me and in all the work that I am doing at my current in my current role, but also that organizations like Women's Heart is doing every day. And go to the next slide, please. And I would be remiss if I didn't take an opportunity to share a bit more about myself and why I'm here today, because the women of this audience that have shared their stories today look a lot like the women who surrounded and showered me growing up, women who have a deep and seemingly endless love for their families and their communities, and they often put others first, sometimes not taking enough time for themselves. I'm fortunate that these types of women raised me to be the woman that I am today, full of hope and following my dreams, and passionate about three things: food, healthcare, and serving communities of color. A sidebar about this picture, it was taken at a COVID testing site where I volunteered most of last summer, or all of last summer really, with the Prince George's County Health Department in Cheverly. It was probably 90 degrees outside and also 90% humidity, but we stayed until everybody got the testing that they so needed that day. And the next slide. All right, so let's go back into the past, starting back in the 1800s, because sometimes we have to raise a mirror to the past to see how it continues to impact us today. Our life expectancy during that time was a whopping 40 years, and there were just two common causes of death identified: infection and shock. We now know that infections left untreated often lead to shock, but then again, this was the 1800s. Slavery was America's largest industry, and slaves were considered to be America's largest financial assets. And therefore, when they became sick, they were liabilities to the production of the plantations that they served on. Living in cramped conditions and also poor nutrition was a recipe for disaster for these people, and they were just one disease away from wiping out the entire workforce. Antebellum physicians, many of whom were also slave owners at the time, didn't have many treatments to offer outside of cleanliness, piety, and isolation when sickness arose in these areas. They had an invested effort into treating slaves, keeping them as assets instead of liabilities. So when they broke down, they often tried to repair them for more work. Enslaved women in particular, who bore children, sometimes dying in the process of childbearing, they also sometimes developed fistulas from traumatic childbirth. So as these women's bodies were considered property, they could not consent to the medical experimentation that they were then subjected to. I list here Lucy, Anarcha, and Betsy, who were subjected to medical experimentation at the hands of Dr. J. Marion Sims, who's known as the father of modern gynecology, but this was during a time before anesthesia and analgesia, pain medication, basically had been developed. These women had no choice in the mutilation of their bodies. But within the same decade, we also see a Quaker woman, Elizabeth Blackwell, who became the first woman to graduate with a medical degree. She was driven by the dying wish of a friend who said that her ordeal may have been better had she had a female physician. And that's just what Dr. Blackwell became. Doctors Elizabeth and Emily Blackwell, who are sisters, established a clinic to treat poor women and children, and later even developed a medical college to teach women medicine in the state of New York. And then came the 1900s, when our life expectancy increased, and as did the number of deaths, or the number of causes of deaths. Rather, medical advancements, the most basic from germ theory developed in the late 1800s, began helping people to live longer as we understood how to manage diseases that people previously died from with the help of pharmaceutical drugs or even surgeries that became safer. During this time, we're seeing a shift from pneumonia to tuberculosis to, by the late 1990s, heart disease and cancer rising to the top of the causes of death. Notable women here include Margaret Sanger, who was also a nurse. While she's problematic for her views on eugenics and her views on who should have access to birth control, she was inspired in her work as a visiting nurse, the women that she visited who lived in poverty and had multiple pregnancies that ultimately compromised their health. Her legacy was a family planning clinic that she developed in Brooklyn, New York, which she was arrested for having opened 9 days after. It became known as Planned Parenthood, and I've heard that they still have a couple locations around today. For women able to have children, Sanger helped them to be able to choose when they wanted to have a child, but more importantly, with whom. The fight for access to contraceptives, however, still continues today. During the same time in the 1920s, Pap smears were developed to diagnose cervical cancer. This is important because Henrietta Lacks, who was a 31-year-old mother of 5, sought treatment at Johns Hopkins Hospital in Baltimore, where it was found that she had a large malignant tumor on her cervix. Lacks was a Black woman, and after a biopsy, her tissue was taken to the lab, and her cells were found to continue to divide outside of her body. And they continue to even divide to this day. They're the longest continuous cell line that we have. HeLa cells, as they're called, are used to study the effects of a variety of treatments on cancer cells without having to experiment on humans. So when we look at the 2000s, one of the most alarming things you'll see here first is the decrease in our life expectancy from 2020. We were at 79 years for women, and now we've decreased it 77. What's happened? This is thought to be due to disruptions in care and delays in medical treatment for things like addiction or depression during the pandemic. Heart disease and cancer, though, continue to be the top causes of death within our nation, although medical advancements have allowed for more targeted therapies that continue to help people live longer with chronic conditions. I'll go to the next slide. Something that helped me get through this pandemic was the reminder that throughout history, we've endured epidemics and also pandemics. I became curious about how news was spread during this time across communities. And in the 1800s, of course, there was word of mouth. There were a number of epidemics that occurred from cholera, influenza, and scarlet fever. But for those who were fortunate enough to be able to know how to read, newspapers were also popular during this time, and also telegrams to share news. When we look at the elevation of public health as a control for prevention and disease being an expertise and knowledge instead of just common sense and social compassion as it was previously viewed, we then see how that transitions into the 1900s when there were a variety of epidemics during that time as well, but we also had new ways of getting news, expanding to radio, television, and later the internet. I have to note here that because I've listed polio as one of the epidemics, that the HeLa cells from Henrietta Lacks, who I talked about before, were instrumental in developing the polio vaccine, one of the epidemics of that period. She's often called the mother of medicine, but I think of her more as the savior of humanity because she saved countless numbers of children during this time. And finally, the 2000s, the birth of the social network and social media that has taken us to new heights of information and also misinformation. Because next I want to explore how we benefited from all of these advancements, but how our levels of education, but also the number of people in our households have had impacts. The next slide. Here, I want you to pay attention to the average number of people per household, because what you'll notice in each era, as women gain more opportunities to advance through education and also in the workplace, the number of people in their household tends to decrease. To me, this demonstrates that the transition of women from being chosen by men in the 1800s to then choosing their own paths from the mid-1900s onward, I have a hunch that it had something to do, may have had something to do with Margaret Sanger, who in her later years, she had helped to develop the contraceptive pill, the first oral contraceptive pills in the 1960s. Although I just learned today on NPR, when I was listening in earlier today, that it was tested on poor women in Puerto Rico and Haiti, which from the history that we've previously discussed is not entirely surprising, but it was something I learned today, so I wanted to share that. As women today, though, we have so many more options and when it comes to a variety of things than our grandmothers could have ever dreamed of. And we also have wealth of information at our fingertips nearly at all times. Next slide, please. So with all the empowerment, let's talk about an organization that has been leading the charge for women in their community since 1999. At such an important time, your champions need to know how to protect their hearts and also the hearts of whom they serve. So here's what you need to know. We've established that heart disease continues to be the #1 cause of death for women and men in the United States. Many people with pre-existing conditions have had worse outcomes with COVID-19 if they contract it. However, we now have 3 safe and effective vaccines that are available, and for all 3 have been recommended by the American Heart Association for women who are at risk, who have been diagnosed with, or even who are survivors of heart attack or stroke. There are some considerations for women who have had solid organ transplant. So anybody with a heart, liver, kidney transplant, there are additional considerations for those populations. Within the last month, Hopkins researchers have published an article finding that 3 doses of an mRNA vaccine may provide more of that antibody response than we're seeing currently with 2. So more research needs to be done on that to actually provide that sort of approval for that segment of the population, but that's just something that I wanted to note here. Please make a plan with your individual care team that knows your medical history best to provide the best recommendation for you. Next up. So we all know COVID-19 has impacted everyone, especially women who still often carry the burden of household responsibilities. So let's explore 4 buckets of impact to women. For childcare, daycare closures throughout the pandemic most severely impacted low-income women and their families, many of whom didn't get paid time off to address these closures. In addition, for employment, single mothers quit their jobs at higher rates due to school closures or unsafe working conditions than married and partnered women. Mental health, something that was discussed during the previous discussion. For some, it was already wearing thin. So unsurprisingly, many mothers, especially mothers with school-age children, characterize the impact of the pandemic on their mental health as major. And finally, in healthcare, many women skipped healthcare, much needed healthcare services during the pandemic. And unfortunately, women with health and economic challenges pre-pandemic are now having worsening health, and they may also have an increased severity of illness post-pandemic, even without contracting COVID-19 themselves. Telemedicine really did play an important role as a substitution for in-person visits, but not all women have access to these services. Whether the availability of telemedicine services will continue in this post-pandemic era, we'll still wait to be seen, or if it will be expanded. But next, I wanted to share the story of one woman's COVID-19 experience. Dr. Susan Moore was a 52-year-old physician who lived and practiced medicine in Indiana. In late November, Dr. Moore developed symptoms of COVID-19, and she went to her local hospital where it was confirmed she did have coronavirus. After days in the hospital and frustrated with her care, Dr. Moore reached for her phone and decided to make a Facebook Live video where she expressed her concerns about her medical treatment or lack thereof by her care team at the hospital. As a nurse, personally, it pained me to watch this video because her pain was so palpable. Women who suffered before her did not have access to social media accounts. So this was one of the first times that we saw that such raw emotion that is recorded for the rest of history. It really raised awareness of the inequitable treatment that she was receiving by people who were trained to serve her. The video went viral, but Dr. Moore's fate unfortunately was sealed. She passed away later and weeks later at another hospital. The health system did open an investigation later that month. She passed in December. They opened an investigation in January, which concluded in May, finding that there was no wrongdoing on the part of the care team for her medical care. However, that she may have suffered from a culturally incompetent care team, to put it lightly. We've lost so many lives to COVID-19, especially in the Black and Brown communities, and the road to health equity is an uphill battle, but it's one that needs to be founded in trust, especially when we are at our most vulnerable, to know that our care teams are working in our best interests. Next slide. And while we can't go back to change the beginning, we can start where we are to change the ending. Next. So when I see this slide, I think about the promise of so many women who stood ahead of, alongside, and of those yet to be born. When we look back 200 years ago, as we did earlier, this may seem like an impossible outcome at this moment, but this is real. There is a woman of color in one of the highest positions of power, a heartbeat away from the presidency in the United States, and her name is Kamala Harris. So let's shift gears next to talk about more of the practical steps in achieving health equity. First, a definition. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. So when we emerge from this pandemic, what does this mean to you? Health equity really does require removing obstacles such as poverty, discrimination, and their consequences, including powerlessness and also lack of access to good jobs with fair pay, quality education, housing, safe environments, and healthcare. All the things that were impacted by the pandemic still continue today, and we still have to repair. Some of those things have been broken for a very long time. Health equity is not about just meeting people. It's about meeting people where they are, not where you think they should be, and staying there with them. So when we look at this slide, what are some of the skills and resources that you have available today at your fingertips to make a difference in your health and also of those you love? When we think about the places we shop, the places the providers that we see, and also where we work, all of these are things that women have to make decisions about, and we have more choices than ever. So we have to choose wisely. When we think about preventative measures, staying up to date with preventative health and also immunizations are some of the most important basic things that we can do for our health at this time. So making it an annual date with a friend, a loved one, is something, going with a buddy always makes things easier. And then consistency is key. Managing a chronic condition is difficult, but it's not impossible. With the support of a community, as you have with Women Heart, having strong people alongside you, it is possible. I'll go to the next slide, please. So I just wanted to share a brief overview of the 3 vaccines that are currently available. There's a little information here, but there's so much more available at cdc.gov/coronavirus. The transparency of information, including the demographic information of each of the manufacturer's clinical trials, is available at cdc.gov/coronavirus. It's amazing and definitely worth a look, so check it out. But here I wanted to list that there are currently two mRNA vaccines. This is the BioNTech and Pfizer vaccine, and also Moderna. Who is eligible to get these? The biggest difference here is that Pfizer is available, is approved for children above the age of 12. Anyone 18 and older can get the Moderna vaccine or Johnson & Johnson vaccine. How it's given, this is where things differ a bit as well. Pfizer is given 2 shots 21 days apart. Moderna is given 2 shots 4 weeks apart. And the Johnson & Johnson vaccine is 1 dose. All of them achieved full vaccination after 2 weeks following the last dose. So for the mRNA vaccines, Pfizer and Moderna, that is 2 weeks after your second shot. For the Johnson & Johnson vaccine, it's 2 weeks after receiving that. And I know that in the press now, there is a lot of, or within the media, there's a lot of concern about Guillain-Barré syndrome that recently came up with the Johnson & Johnson vaccine. So again, please talk to your healthcare providers about which vaccine you think would be best for you, but then also in getting a recommendation from them as well. All of these vaccines are available at no cost to patients, and our appointments are typically not required in most areas at this time because we've reached a point where our supply actually outpaces the demand for the vaccine. I would encourage that if you are not vaccinated and you are considering it now, to do so sooner than later, because we are aware of variants that the virus continues to mutate while it has an opportunity to do so. We hear about the Delta variant right now, and when we go into the fall, we're not sure what new variants will be, existing in our communities. So that's why it's so important to act now if you can and be more proactive about getting vaccinated. Next slide, please. Great. So some of the questions that come up frequently are about eligibility, about where to access the vaccine, and then knowing which one that is best. And we've covered some of this already, but just to make it crystal clear that everyone's eligible to receive the COVID-19 vaccine if they're now 18 years or older, but also 12 and older with approval of a guardian. This was effective as of April 19th of this year. Where and when can they get the vaccine? Almost anywhere. Most pharmacies, grocery stores, workplaces, some are even offering home services now to meet people where they are in their communities to administer the vaccine. And then how do you know which one is best for you? As I mentioned, all of these vaccines have met strict and vigorous safety and efficacy standards by the FDA. So talk to your care team about any concerns that you have about your specific history and how the vaccine may interact with you. Next slide. And if you do choose to get vaccinated, you will be in good company. As we know throughout history, or as we've seen too, women have made pivotal decisions and sacrifices that have made it possible for us to be here at this moment today. So how will you now meet this moment? 159.3 million people have received their vaccinations and they're fully vaccinated. As we look at this map of people who have received one or more doses across the country, we're seeing in green. We want to see green across the board, but we're not there yet. So there are areas who have achieved that 50% or greater vaccination rate in their communities. The lightest blue are the areas where we're still seeing that that some people have not been vaccinated yet to the level that we would want. But there's still time and there's still hope. There's still a lot of information for people to receive to be encouraged to get vaccinated. And next, I wanted to share 2 people who have been vaccinated. So, I think on social media, there are a lot of people who share pictures of their vaccinations. I did not share mine on social media, but I'm sharing it here today. So this is me after my first dose. I have my mom in the center, and I had the privilege and honor, I consider it, to administer my sister's first dose of the vaccine. We continue to volunteer together now. She registers patients for their vaccination when we do drive-through clinics or mass vaccination sites or pop-up clinics, and I administer the shot. So we're a great tag team. Next slide. So great. I'm going to begin to conclude here with women and health equity again. So as we look at the broader view of not only COVID-19, but also other preventative measures that we can take for our own health, what's possible? So we know that many women have delayed or had canceled medical care during the pandemic. So how do we get the train back on the tracks? What behaviors do you really want to model for your loved ones? After. So thinking about getting your own COVID-19 vaccination or encouraging others to do so, how can you extend a hand in your community? Maybe it's by giving somebody a ride. We know a lot of people who have had trouble accessing transportation to and from getting vaccinated or even to regular doctor's appointments. So what if you could be somebody who helped accompany them to their appointments? Double points if you take them to and from. And then also I wanted to highlight annual wellness exams for women 20 through 75. And talk to your primary care provider about getting cancer screenings and also understanding your risk factors for cervical cancer. So that's through cervical cancer screenings of the pap smear for HPV, which is the most common form of cervical cancer. Which can lead to, HPV can lead to cervical cancer. Mammograms for breast cancer, colonoscopies to screen for colon cancer, and then bone density for osteoporosis. And then finally, exploring new ways of doing and being. When we learned how to work online so quickly, we're having a virtual conference right now. And we also learned the benefits of masks to prevent the spread of disease. We can continue to use masks during every flu season. I still wonder why I wasn't wearing a mask. I used to travel as a consultant Monday through Thursday, and I look back at that like, why wasn't I wearing a mask every single time? But what changes have you made in your life during this pandemic? Maybe some of the sacrifices are changing into your habits, either clustering the time when you go to the grocery store, choosing healthier options for yourself, making sure that you have your annual checkup. What are some things that you're going to continue to do to maintain your health and also improve the health of your community? Is what I want you to think about. I think that takes us to the end of my presentation, and I wanted to open up for discussion, but just leave you with health equity is definitely a journey for all women. It's a journey, it's not a destination, and it's something that we, again, have to continue to build upon trust in our medical providers, and it's that collaboration that will really take us to the next level. So thank you so much.